question that came through Facebook is, how can we find out if a child's case is genetic?
Yes, that's a very good question. So once your child has been diagnosed by, specialist, whoever it is, whether it's a developmental pediatrician or a psychologist or a neurologist or a pediatrician too, like I think more and more pediatricians like me are doing the diagnosis. We usually do recommend genetic testing. And, especially if there's a family history, and often I find that there is a family history of a cousin with autism or a speech delay or some other issues that they had in school, then we will recommend seeing a geneticist. Having said that, a lot of insurance companies, I know if everybody is on insurance in the United States, don't cover genetic testing. So recently I just came across, there's an organization called Spark for Autism. It's they're doing research on the genetics of autism. So they would be happy to send you a kit and do the genetic testing for free. And they'll notify you if your child has one of the mutations that they see in autism. And they will keep it private. They're not going to share the data. They're doing it more for research to see what all mutations are there. So if anybody wants to look at it, it was called Spark, SPARK, for autism.org.
Okay, perfect. Sparkforautism.org is the website to look for. And thank you so much for answering the question. Hopefully the parent or whoever asked a question, you got the answer. If you have follow-up questions, please let us know. We do take questions live on Facebook. So you mentioned, Dr. Sangeeta, some symptoms which are triggering, but we sometimes overlook because we think, oh, the child will talk, oh, they will walk, they will do steps. So if the parents who have young kids right now, and what should they do? Like if they think their child has autism because of the reasons that you just described, what should they do in that scenario?
Yeah, so the first thing I think all new parents and parents who have little kids, they should do is they need to track their child's milestones from the beginning. So CDC actually has a great milestone tracker. It's an app. And they just recently updated because they've updated the milestones, and they've mostly done it to pick up autism because we were still not good at picking it up. So if you track your child's milestones, then as soon as you see something doesn't fit, you can talk to your pediatrician. So don't wait for your pediatrician to make that call, because as I mentioned, I've been a pediatrician, so I know, when practicing, it's sometimes very hard to take care of so many things. So, and nobody knows our child better than the parent, like the mom and dad who spend the most time with the child know the child the best. But if you have some type of guidance, like the CDC milestone, the tracker, then you can see if your child is showing any signs. Then if you worry when you're doing that your child may have autism, there's another great site called Autism Navigator or Baby Navigator. They have lots of videos. This is a free, a website. And you can then see what are the things that they talk about. And then they even have a questionnaire and you can fill it out. And if you have a certain score, you can take it to your pediatrician and show that, I'm worried my child could be on the spectrum. And then they can then offer the MChat and then go from there. And then if that is abnormal too, then they can refer you. But the key thing is to be very observant of your child. I know, these days we are all so busy, especially, with work, the pandemic, we have so many gadgets. So we sometimes forget to observe our kids. So my plea to all parents is please observe your kids very closely, spend a lot of time with them, talk to them. And, you really don't need fancy toys. You just need to be there with them and know your child.
Yeah, that's actually perfect. I like that. So be there, be in that moment when the child is doing activities, and calculate all the milestones, which is very important. So thank you for that enlightenment. So what are some characteristics that the parent who are listening to us right now, some characteristics of autism that they might observe? Like the milestone, you said CDC has a chart, but besides that, anything else that they should be observing?
Yeah, so just a few things, like at 1 year, if your child is not responding when you call them, so that 12 months, so that's a big red flag. Then by 15 months or so, if they're not pointing, like kids would point, even if they're not talking, they'll point if they want something. And they'll look at you and then they'll point. Yeah. So if they're not doing that, or if you point at something, you're like, oh, look at that airplane, and they don't look up at this, at the thing that you're pointing, then I would be worried. And then by 18 months, if they're not doing any pretend play, like pretending to cook or feed their, baby doll, talking on the phone, if they're not doing that, then I'd be worried. Of course, language, a delay, most parents will pick up that, they'll say, oh, they're not talking, or they were saying things and they've stopped saying. So there are about a third of kids with autism who seem to have what we call a regressive type of autism. They are developing just fine till about 18 months. And then something happens between 18 months and 2 years and they lose their skills. So I see that very often, and that can be very terrifying for parents. Like they were saying all these things, they were waving bye-bye, they were blowing kisses, these gestures that we're talking about, and then suddenly they stop doing it. So if that happens, then that certainly is a big red flag.
Okay.
And then of course,
so
lack of back and forth communication. Like even if they're not talking, like if you are, as I mentioned, if they're just talking, but they only talk about what they want, and they want to talk about the alphabets or shapes or colors, but not about where are your shoes? They don't understand that.
Okay. Thank you for that. So I have another question that just came in from Facebook Live. So the question is, my niece is 2.5-year-old. She hasn't started speaking, but does all the other stuff that you mentioned, like imitating adults, pretend play, etc. Is that normal, or is that early sign of autism?
Yeah, so that's a good question, because some kids may have just what we call expressive speech delay, which means they can't talk, but they understand everything, and they have great facial expression. They have gestures, with gestures they can explain whatever they want. And then if that's the case, then it may just be expressive language delay. But if your child, if your niece is not talking till 2.5 years of age, definitely this needs to be brought up to the doctor. Maybe she has a hearing, maybe a deficit, because maybe she had a lot of ear infections. She can't hear, so of course she can't say those words. So certainly 2.5 is too late for a kid not to be talking. So this does need to be evaluated, whether it's autism or just expressive language delay, or just maybe, frequent ear infections. And that's something they need to talk to the doctor.
Okay, so hopefully you got the answer. It's better to get checked and get a second opinion. So,
yeah, I'm sorry. I have one quick thing. I do not like the approach of wait and watch. A lot of people do that. No, it'll become okay. Let's wait and watch. We don't want to wait and watch. And, this is our kids' development. I'd rather go ahead and do more now and find out, oh, we didn't, this kid was just fine. But that time that you lose, when the brain is developing, is very, very precious. So if your doctor says, let's wait and watch, I think that's a little old-fashioned. They need to be up with the times. You don't want to wait and watch.
So be proactive and go and get a consultation right away. Thank you for that. So can a child outgrow autism?
Yeah, so that's a good question. So, because, there is no one test for autism. So it's not like you do a blood test and, like if you have a thyroid disorder, your thyroid level is low or high, then, you have that. So because it's a collection of symptoms, with early therapy, there's a chance that symptoms may get so mild as they get older that they may not fulfill all the criteria. So in fact, the recent American Academy of Pediatrics, they just did a full review of autism guidelines. And they did say about 9% of kids do outgrow the diagnosis. And these kids are the kids who were mild to start with or who started therapy very early. So they outgrew all those criteria because, there are a whole bunch of criteria that you have to meet.
Okay, wonderful. So how widespread is autism?
Yes, that's again a very good question. So, when I was probably when I was in medical school, it was a long time ago, we barely heard about autism, and as, I have, finished my training and I've been in practice, the prevalence has gone higher and higher and higher. So the latest prevalence, which just came out in the last 1 year, is 1 in 44 kids. So it means almost 2%, more than 2% kids have autism in the US. The latest data from India I saw was 1%, but I think it's because it's still not diagnosed as much. So I think there is no reason why one country would have higher than the other. I think it's just a matter of diagnosis. But the United States is 1 in 44, so it's 2%.
That's a scary number to think about.
That is high, yeah. And then the other thing people don't realize is the cost with the not doing anything. The cost of kids, if you don't treat them early, if you don't get them into intervention early, the lifelong cost is very, very high, much higher than a lot of other chronic illnesses, because you end up spending a lot of resources trying to get them caught up in school, then psychological issues, medical issues, then employment, all of that stuff.
So that's a perfect segue, because my next question was, like you mentioned, it's treatable if diagnosed early, and if they are not.
Well, I won't say treatable because it's not a disease. So yes. It's more like you have made a lot of those atypical features and the things that affect their day-to-day functioning much milder, and you have taught them how to connect with people and to learn and to have some of those atypical behaviors go down.
So you mentioned, and I'm going to stick to US, you mentioned 1% in India, 2% in US. It's a scary number. So do we know why autism population is growing, or what's causing it to grow besides COVID?
Well, COVID is just like this last 2 years. This has been going up, since the 80s, just every decade it keeps going up. Well, there are a number of theories, again, nobody knows. I think because like 50, 60 years ago, a lot of the people who had autism were probably classified into different, diagnosis, maybe like intellectual disability, mental retardation, or some other psychological disorder like ADHD or anxiety. And now we are identifying that a lot of them, actually the root cause was autism. So they're being now pushed into that, into that basket of diagnosis. But also, I think there seems to be genuinely an increase in prevalence, whether it's because of environmental factors or something else, we don't know.
Okay. So,
not vaccines.
Not vaccines. Okay. So, when parents know that, okay, my child has autism, how can parents participate in the diagnosis, or after the diagnosis? What should parents do after they find out that the child has autism?
Yeah, so we didn't go over what the treatments are, the interventions are. So essentially, when your child is diagnosed, they do need a comprehensive intervention. Of course, speech and language therapy is very important. The other thing that they need is something called OT, or occupational therapy, which helps them with a lot of those sensory issues that we talked about, because that's important. With as long as they have those sensory dysregulations, it affects their learning. Then the cornerstone of treatment, the gold standard of treatment for autism, is something called ABA, or applied behavior analysis, in which basically they use a behavioral approach. and it's a one-on-one thing. That's why it's very intensive. It is expensive also. And it is done by behavior therapists who have had extensive education, ABA therapists. You need all three of these. But a lot of places don't have ABA therapists because they as I said, you need a lot of qualification, and it's also very expensive. So a lot of low middle income countries, and even in India, I know a lot of centers, they have come up with programs to teach the parents, these behavioral principles, so they can do that and at home. During the pandemic, also a lot of places came up with it because you couldn't see a therapist. And the parents live with the kid, so you can't just go to a center, do the therapy, and come home and you're back. So the parental involvement is very, very important, and I have seen, great success stories because parents just totally dedicated their lives to their child's benefit. And, it shows, I know, there are people very close to me that, who really gave up their careers, I'm not saying you have to do that, but, some of them did and totally dedicated their life to get their child back on track, and the kids are doing really well. So yes, parental involvement, very important.
Very important. So there is a hope, if you
and there are a lot of
together.
support groups. Yes, there are a lot of support groups now, so the parents can learn from each other, because not every child has the same issues. In fact, they say if you've seen one kid with autism, you've seen one kid with autism, because every kid has different challenges, different strengths, different deficits.
Okay, wonderful. Well, thank you so much. Let me check if we have any questions. I don't see any more questions from our Facebook Live. So with that, it's a wrap. I just want to remind our viewers and listeners, you were listening to eGlobalDoctors Facebook Live. It's a complete healthcare platform solution for all medical related issues and questions. And you can have all these services at your fingertips without breaking your bank, and you don't even have to drive. It's from your comfort of your living room. You can have all these facilities. If you can actually connect with eGlobal on LinkedIn, Facebook, Instagram, Pinterest, YouTube, Twitter, all the old-fashioned way, eglobaldoctors.com. Indian origin folks living in US, if parents are visiting from India and are looking for medical consultation, well, look no further. eGlobalDoctors has your back. Access to doctors from USA and India. Specialties include, but not limited to, internal medicines, cardiology, orthopedics, oncology. Prescription will be provided. Response time is 1 to 3 days. Family members can participate via live video physician consultation from any part of the world. Video consultation is up to 30 minutes. In-app messaging with doctors after consultation, ID and portable health passports. So Dr. Sangeeta, thank you so much sparing time for us. I know you're super duper busy. So before I let you go, any word of wisdom that you want to share with our viewers and people who are listening to us right now?
Well, one thing, the parents should not blame themselves. I see a lot of that. Parents say, oh, I didn't have time. I was too busy. I didn't spend time with the, don't blame yourselves. Just, be your child's advocate. If you think that there is an issue, just, make sure that somebody checks it out. Don't wait and watch.
Yeah, I was going to repeat that. Like you said, don't wait and watch. It's better to get the opinion right away. So thank you so much. Thank you for giving your Friday evening to us. Enjoy your rest of the day. Thank you so much.
All right. Thank you. Bye-bye.